This is the soundtrack of chemotherapy. How are you feeling, Mom?
Okay. I suppose you come with every time you walk in, like it's a hope thing. You feel hopeful that somebody's doing something about your problem.
The chemo room was a large, bright, horseshoe-shaped room. And all around the curve are these big armchairs. In the middle, the nurse's station, and next to the chairs are these tall, white machines, all bleeping at regular intervals. In the armchairs were a range of people. At the far end of the room, in the last chair, was an older lady, sitting quietly. She's lost her hair, her eyebrows, and she's wearing a headscarf. An older man sat next to her, maybe her husband. The two were sitting in a comfortable silence. In another chair was a young man with a full head of hair. He didn't look a day over 30. He was alone and on his phone, smartly dressed, maybe his work clothes. It was a busy room. The nurses were constantly on the move, checking the machines, checking the patients. The machines have this little interface with numbers and a stand, and at the top is a brown bag of the chemotherapy, which will be pumped intravenously.
Oh, when I came the first time, I came with a big entourage. So we are walking in and we see this big pod, got greeted at the door. For me, very sadly enough, it was like, oh, let's see what this is like. I wouldn't call it adventure, but it was like a next step in this treatment process. I'm not feeling too well as I walk in because I had fluid in my lungs, which I didn't know about. But there was like just the sense for me, as with everything else in life, the excitement of the new, whether it's a good thing or a bad thing, it was like, it's new. So I'm walking in and saying, okay, let's see what they're going to do. Like, what's chemo? What is chemo? I have no idea what it is.
This is Overlooked, a podcast about ovarian cancer. I'm Golda Arthur, and you're listening to the voice of my mom, Teresa. In this episode, chemo and what treatment for her cancer was like. Mom had her first chemo session in the summer of 2018.
Really? The chemotherapy was like so important in this whole journey, though it's probably played havoc with every system in my body. Initially, nobody had told me that it's a process where there's intravenous and things like that. Anyway, we are seated. They come and find the vein. They inject it and they said, oh, this is Benadryl. Now we are putting in saline. Then we are going to flush it. And like they walk me through this process. But it was a feeling of confidence and a feeling of, okay, this is a bad flu and now I'm going to take Tylenol.
This was at a time we were diagnosed with stage 3 ovarian cancer.
That's right. But it was like, you're not thinking about, yes, I guess somewhere at the back of your mind, you're thinking this is cancer, kind of. But at the same time, I'm walking in and I'm thinking, okay, this is going to be fine.
Cancer was the problem and chemo was the solution. It was as simple as that on some level.
So we walk in, we came prepared with a lot of lunch, like puff pastry and some kind of, samosas or something and some juices and fruits. We had a whole bag of lunch to go around.
I did tell you that my mom was a foodie, right? That first chemo, of course there was lunch.
And we are getting the lunch out, enjoying the lunch, chemo going in, like pumping in like at a fast rate.
And there was a group of us. My sister, my dad, we all came to the hospital. All us brown folks with samosas sitting in the waiting room outside. Inside the chemo room itself, there was only one person allowed in with Mom, who sat in one of the big chairs. The session began with a nurse inserting an intravenous needle into one of Mom's veins. The needle was attached to a drip on the white machine. 2 nurses had to double-check the records to make sure the right patient was receiving the right drugs. Then, the chemo drugs were hooked up. And in between the administering of each drug, a saline flush to clean out the IV lines. Chemotherapy drugs kill fast-growing cancer cells. They do this by targeting the DNA of the cells. But these drugs are an indiscriminate killer. It targets any cells that are multiplying fast. And we've got lots of these cells in our body just doing their thing, like in our digestive tract, or the ones that cause your hair and your nails to grow. So those healthy cells get killed off too. Chemo is toxic. That's why the nurses were all wearing this plastic sheeting, like a plastic dress, over their blue scrubs, as well as double gloves.
So we're doing carboplatin this time now? Okay.
Mom had 3 drugs. They're called carboplatin, Calyx, and paclitaxel. At that first session of chemo, things were going fine until they administered the most powerful of the 3 drugs, paclitaxel.
And then the next thing I know, I'm feeling a very bad pain, not even a shooting, but more like somebody's grabbed my back muscles and are trying to pull them apart. The pain kind of projects in the tummy. And again, looking back, I realized that was too late to say I'm getting pain. I should have talked about it earlier. So the next thing I know, I'm literally voluntarily stopped breathing because it was so bad. And then I'm told this is a reaction. So the curtains go swishing around, isolating me in the pod. And they stopped the paclitaxel.
They gave her Benadryl, a powerful antihistamine, to control the reaction.
And took a long time for the pain to literally go away. Then decisions were made about whether they should continue with paclitaxel. And it was for the moment, it was very devastating, but more because I'm thinking, are we going to just stop treatment? And what's that going to do for me?
Much later, Mom and I talked about what happened that day in a conversation that I recorded.
I think it was an allergic reaction to the paclitaxel, which is the big one. If your allergic reaction is very bad, that's it. You don't get that chemo. Now, I had a very bold doctor who said, where I got this reaction, and it was like I couldn't breathe, and it was like there was a big vice around my chest. It was a reaction, allergic reaction. Then they wanted to know whether they should continue with it. And he said, give it to her. They called him up and he said, it's okay. And I just prayed and I prayed.
Those nurses, they moved like a silent SWAT team, converging on Mom's chair, conferring with the oncologist, administering the antihistamine. Efficient, coordinated, calm, supportive. Mom made it through that incident, but at the end of that 5-hour chemo session, they had discovered the fluid in her lungs, and the doctors decided to admit her to the hospital that night. You know the story from there.
This is her fluid, puppy.
And after the fluid was extracted, Mom was sent home and her treatment continued. We would soon see all the side effects of all that chemo. In the short term, for 3 days after the infusion, Mom was chemotoxic, which meant any fluid coming out of her, like sweat or vomit or spit, was toxic to others. So she had to go into a sort of isolation at home for those days. She would sleep in another room, shower in another bathroom. No one could touch her or hug her. In the medium term, for about 10 days after, she was weak, exhausted, sleeping all the time. In the longer term, Mom lost all her thick, black, glossy hair. All of it. There was constipation and diarrhea, nausea on the regular. Her fingernails turned black. And this is not even an exhaustive list of what happened to her. And then there was the pain.
Oh my God, it's like somebody's taken a sledgehammer and breaking your knees and your calves and your ankles so I couldn't sleep on the same room or bed with Dad because it was like I would be moving, shifting. During the chemo days, I was sleeping on the other bed in the other room so I could moan and groan with the pain and get up and take the painkillers in the night. But I think it was worse than the chemo administration. When they put it in your vein and you're spending the whole day there. It was so bad. The good thing was that it was terrible for a week. Then it went down a little bit of nausea. Fortunately, I was not one of those, like lots of vomiting kind of people. I just had once or twice, I think it was. But in any illness that I have, my worst fear, what I'm most scared of, is nausea. And so, of course, chemo was accompanied by nausea, but I think subconsciously I tried to make sure I didn't throw up. When you're throwing up, it's like you're in a very helpless state. And I usually tend to faint when I have nausea. So it's like, that was the worst part. Then the next 15 days, I'd be fine. And then I'd be cooking and I'd be eating like crazy. And then another week of real good, nice, no pain, pretty normal. And then the chemo would start again. And then I tried not to anticipate the pain because that would make it more. But it wasn't so bad, actually. When I look back, I can't remember the pain. I only know that it healed me. It was the healing.
Pain and healing, two sides of the same coin, I suppose. These drugs wreaked havoc with Mom, just as they saved her life. We're back after a break. I wanted to pause for a quick second to tell you about our website, overlookedpod.com. You can find out more about the podcast and get in touch with us here. And you can subscribe to the show on Apple Podcasts, Amazon Music, Spotify, or wherever you're listening to this. Now, back to the show. To understand what these drugs are, I talked to Dr. Sakarajic, the gynecological oncologist attending to my mom. I asked her to explain to me in a really simple way, starting with carboplatin.
So carboplatin is a medication that is used quite a bit in a lot of gynecologic cancers and quite a lot of other cancers as well. So carboplatin is like the quiet guy who does his work, who doesn't bother anybody, really, who doesn't make you lose your hair. They're just like a hard worker. Definitely can have some side effects. When that quiet worker has had enough, they're going to explode. But for the most part, they stick to themselves. So basically, carboplatin, the side effects are things like being a bit tired, having maybe a bit of low appetite. We watch blood counts really closely, so they can go low, but usually tend to be okay. Can give a bit of nausea, but doesn't make you throw up a lot. So all things that can be really controlled. And it's a medication or a drug that we give to people even if they have a lot of other health issues, if they're not very well, if they're very frail. Usually most people can do okay with it. So that's carboplatin.
And then paclitaxel.
Paclitaxel is very different. Paclitaxel is the bald punk, just not a nice person by any means. So paclitaxel makes you lose your hair. Paclitaxel gives you bony and muscle aches. It can give you an allergic reaction. It can cause numbness and tingling, neuropathy. Again, it can also lower blood counts, cause an infection, that kind of thing. So that's paclitaxel.
And the last one, Caelyx.
The things that are most common with Caelyx is dry hands and dry feet, rashes in all the places that rub together. It can very, very rarely have some cardiac effects, but it's quite uncommon. It can make people tired. Chemo in general makes people tired. Maybe a little bit of nausea. It causes sores in the mouth, things like that. Yeah.
Chemotherapy is only one part of the treatment for ovarian cancer, though. There's also surgery, what they call debulking. Debulking is, as far as I'm concerned, a clinical, ugly term. But what it means is that the cancer is physically extracted, removed from the body. It seems obvious to say now, but that was the moment I realized cancer was a thing you could touch and feel, a material thing, not a concept. Dr. Sakarajic has performed this procedure.
So it really depends. So it can be like a mass in the pelvis. I don't want to gross people out, but sometimes it can be like hamburger meat. It can look like that. Sometimes it can be like little white nodules. It can be like a plaque. It depends a lot of the time. It's not one specific thing.
This just makes it hyper real for me. I flew back to Halifax to be there for the first chemo, but I couldn't be there for the surgery a few months later. Mom called me from the hospital after it was all over. It was a video call that popped up on my phone while I was on my way home from work, waiting for a train in the subway in New York. She looked like how you look after a major surgery, frail and exhausted. And when I asked her how she was, you can guess what she said. "I'm fine. Everything's going to be fine." When the call ended, I stood there on that subway platform and just wept.
What do you think kept you going throughout when you look back on it?
Oh, just the family, I think, Ola. It's all of you and the children and, like talking to y'all regularly and y'all being there. That kind of kept me going from moment to moment. And family is so important. I think I feel very sorry for the lonely people who have cancer, who have nobody to be there with them. That's a big motivator. Family. You need to do this for your family.
In the next episode, family. Overlooked is written and produced by me, Golda Arthur. Our associate producer is Jessica Martinez Dios. Lissa Soep is our editor, and Eric Gomez is our sound designer and engineer. Please share this episode with someone who would like to listen as well. Subscribe to the show on Apple Podcasts, Spotify, Amazon Music, or wherever you're listening to this. And for more information about the show, check out our website, www.overlookedpod.com. Thank you for listening.